So it's been 10 minutes and the little result ready dot on our test has filled, and we're in the 5-minute window to read the results of my urine test. And there's 2 lines to be read in each of the 5 windows. The top line is a control line, which just simply indicates that the test is working well, in good working order, and everything's gone as planned. And the presence or absence of the line below, indicated T, is what we're concerned with. If there's a line present, even if it's faint, that indicates that the test is a negative, that there is no drug metabolite of that particular type of drug to be found in the urine. If the line is absent, if there's only one line in the form of a control line in any of the windows, that indicates that that drug has been found in the urine and could and should possibly warrant further testing via the laboratory mail-in sample. So taking a good look at my urine sample here, across the board, 1, 2, 3, 4, 5, there are lines present, meaning I have tested negative for all 5 substances that this particular drug test does test for. There's no guarantee of positive or negative. You can suspect somebody of using drugs and maybe there aren't. I think that anytime a drug test is used, especially for another person in your family or otherwise, a measure of counseling is advisable to ascertain whether or not somebody is using drugs and what problems may or may not be.